Hi, I'm Fred Joyal, author of Becoming Remarkable, How to Create a Dental Practice Everyone Talks About. I want to talk to you today about teledentistry, why and how it's important, and how you can incorporate it into your practice. And I'm going to give you a 12-step guide for doing just that. So let's talk about why. Well, right now, during this crisis, you're not seeing regular patients. Most of you can't see regular patients. So what's happening with these patients who have dental emergencies? A lot of them, if they can't get a hold of a dentist or they don't have a dentist, are going to the ER. They're not going to get properly treated there. They're going to overwhelm the hospital. The ERs in the hospital are already overcrowded. They're not going to get the problem solved, and they could leave with COVID-19. This isn't what you want to happen for your patients, and this isn't what you want to happen in your community. So how do you solve it? You solve it with teledentistry, a way to triage a lot of dental emergencies, maybe not have to see them right away, but at least keep them out of the ER. Because it allows you to find out what's going on with the patient without seeing them and finding out if you actually need to see them right at that moment or if there's something else that you can do. And making teledentistry available during this time when you're not seeing patients lets them feel that you're there, makes them aware that you care about them, you're available for them if they need you. And it can also attract new patients, patients who don't have a dentist. If you're willing to use teledentistry to see those patients, it's going to make a huge difference to somebody who doesn't have a dentist, to find you available there, communicating with them, possibly getting them out of pain, could turn them into a long-term patient. And now, you can get paid to do teledentistry. These are all good reasons to incorporate teledentistry into your practice now. Also, the fact is telehealth has surged in search. Telemedicine, teledentistry, people are searching for these things more than ever. One, they can't get into a doctor, they can't get into the ER, they have a dental problem, they're going online. They're searching for a way to solve this. Teledentistry gives them that way. If you can come up in a search that way, you're going to attract patients, as well as be able to take care of your own patients. And most dentists don't have this set up. Almost no dentist I know is actually set up to do this. And of course, they've relaxed the HIPAA requirements for right now. So you could do a Facebook or a Zoom or a Skype call with the patient, but it's very low resolution. In the long run, it's not going to be HIPAA compliant, and it's not robust. It's not solving a lot of problems. It's just allowing you to see a grainy version of your patient. So let me give you the 12 steps to incorporate teledentistry into your practice, because this is part of the problem, right? You don't know how exactly to get this done. It's a new technology. And of course, I understand that for medicine, most of the time, for a physician, this seems like it's more useful. And it certainly is, because for most dentists, you got to get in their mouth and solve the problem. But 10, 15, 20% of the time, you don't have to do that right away. And you can help the patient out and solve the problem maybe long enough so that maybe you realize that eventually you do have to bring them in for emergency, or maybe you can do something that postpones it long enough that you may actually be open again. So, step one, choose the right platform. There are a whole bunch of platforms coming out now, and some of them come from healthcare, some of them are made for dentistry, some of them are very simple. You are going to be looking for something that is comprehensive, that's robust, not something that solves it simply, or that is maybe being overwhelmed already by the healthcare industry. Some of these systems, some of the more simple ones, are actually breaking. In other words, they stop functioning in the middle of a call. You're never going to want that to happen because their servers are getting overwhelmed. You're going to want to choose a strong platform. The platform I'm going to talk about today is Patient Pop's telehealth program, because it's the most comprehensive end-to-end solution that I know of that's still very affordable. But either way, whatever you use, figure out a way to incorporate teledentistry into your practice. We want to keep people out of the ER. You want to take care of your patients. You want to be available for them in this critical time. Step 2, let your patients know that you offer teledentistry. You want to be emailing them using Demandforce, RevenueWell, Patient Activator, whatever you have, to tell your patients that you have this service. This way they can hear about it and you can offer connection to you without doing what I normally recommend, which is to give the dentist's cell number to all your patients so that they feel like they can get you if they need you. Now you don't have to do that. You can say, we have telehealth. You can send them all an email. You can send them all a text. If you have an emergency, we have teledentistry available to you. So this is an important step. Let your patients all know that you are there for them. Use your communication tools to let patients know. And of course, if they call, or if you have an emergency line or an emergency message, you're going to want to put that there as well, and how they can get a hold of you through teledentistry. Step 3 is to schedule those appointments. Actually schedule a teledentistry appointment with the patient. If you're using Patient Pop, you can actually do it on your website. They'll put a module on your website that'll have your schedule, that actually control it and limit it by provider, by location, and the reason the patient's calling. And that's going to seamlessly integrate into your PMS, into your schedule on your PMS. But if you're going to do it in some form, no matter what, you can just create a new column in your PMS, like another room, your teledentistry room in your PMS, so you can keep track of those appointments. Most of those appointments are not going to be that long. With the dentist, they could be 5, 10, maybe 15 minutes long. And you want to let people know that they can do that. That's why you want it on your website. You want that to actually come up in a search, along with that you offer teledentistry. In a Google search, if your practice comes up, your website shows that and has the schedule, they can schedule it right then. That's a tremendous option for people and what people are looking for today. Remember, we live in an open table world. People want to be doing this stuff right then. And because you've done it through this system with Patient Pop in particular, they're going to send messages, reminders to the patient to let them know, to confirm the appointment and to remind them of the specific time of that appointment so that they don't miss it, so they know that they have it, they know they're supposed to be there, and then you connect with them. Also, if they don't show up, it's not a big deal if they don't show up for teledentistry. They should, and they probably will because they're an emergency patient, but it doesn't do as much damage as them getting you to the office for an emergency and they don't show up. Step 4, and this is critical, use an assistant, use a team member to triage those patients first. Find out what's going on. Are they a patient of yours? Are they a new patient? What's going on? If they're ready to be seen by the dentist, now you get to step 5, which is also done by the assistant, which is gather all of that patient's information. If it's an existing patient, just update the medical history, allergies, medications, all of that stuff. Update their insurance, find out if they have insurance if they're a new patient, or find out the method of payment. And then, also this is important, let them know there's a charge for this. You're going to charge between $75 and $150 for this teledentistry appointment. This is the normal rate. Now, you may not be able to collect all of that from your insurance. You decide what you want to charge, but inform the patient that this is going to be charged for and what the charge is. Very critical to do that, because people a lot of times think, oh, it's just a phone call. No, it's just a phone call with a medically trained professional. That's the big difference. And so now you get step 6. Now the team member either transfers it directly to the dentist, the patient, or schedules it. Say, okay, the dentist can see you at such and such a time, or talk to you at such a time. And see you is really what you want to say, because that's what's going to be happening. They're going to see you on camera. And so, you know, it's teledentistry. So you schedule it, or you connect the patient directly to the doctor, and the doctor comes on once this has been scheduled with the patient. Step 7, now the dentist is there. Now you can do the patient exam. You can ask them questions. You can find out what's going on, diagnose what's going on, do an exam, look at, you know, have them show you what's going on as well as describe what's going on. Step 8 is that you will be able to do chat as well. Now, what you're going to have here is high definition video, two-way, a chat box where they can put pictures. So step 8 is use that chat bot to write information that you may want them to understand, whether it's a specific prescription that you recommend, or a treatment that you recommend, or a behavior or steps that you want them to take care of themselves in the meantime. Let's say they knocked out a tooth. You're going to give them the steps on how to protect that tooth until they can get into the office. You're going to use that opportunity to tell them what exactly you recommend based on what you can tell, or you're figuring out, I need to bring this patient in. There's nothing else I can do visually or with just a diagnosis and a prescription. Also, very important, dress up. Because all you've got is this visual medium, you don't have a whole office that looks like a physical environment that's a healthcare environment, like a dental practice, your beautiful surgical suites. I would often wear a shirt and tie, or even a lab coat, just to have them feel like they're talking to a real dentist. Make them feel like they're talking to a medical professional. Because, why? They're going to be paying for it. And you can do the charting right there. If you're using the Patient Pop telehealth module, you can do the charting right there on the patient. You're going to be able to save all of that. And they can even send photos, you know, take close-up photos, put those in the chat side as well, and you can take a look at those. So they'll even get better pictures. Maybe the high definition is not playing as well as you want. They can still send close-up images to you that they can take with their phone for you to look at. So you've got all of that in the chat bot. Step 9, recommend what you're going to do. Recommend treatment. Is it a prescription? Is it some steps that they need to take care of themselves for the next few days or even the next few weeks? Or do they need to get in? And that's step 10. Call in a prescription for them, or schedule an appointment when you can see them, or how urgently you think you need to see them, or do both. You may need to send them a script for 2 days and then see them. Or you may need to start them on antibiotics and then see them in a day or 2 or 3. If you're using the Patient Pop system, they have an e-prescription system built right in there. So you can send the prescription right there to the patient's pharmacy. One more easy step, and that's the whole idea. You want a solution that's comprehensive enough to do all of this stuff so that you're not doing stuff 2, 3, 4 times, or not doing it at all. Step 11, get paid. This is the time to collect the payment or the copay. We have codes for teledentistry now. Use the codes D9995 for a live conversation and D9996 for an asynchronous appointment. These will allow you to run this through their insurance and collect what you can from their insurance. And if you've got a copay, then you're going to be able to collect that because your team members already gathered credit card information ahead of time. Finally, transfer all of this information into a patient record in your PMS. If you're using Patient Pop or a tool that's robust like that, it should go straight in. to the PMS automatically with a click or two, and it's in, and you've created a patient record or you've updated an existing patient's record. This is so important to be doing now, I think, because being available, you know me, I'm the marketing guy in dentistry. Being available during this critical time is good marketing. It is creating a remarkable patient experience when they need you most. And it may be the first experience of your practice because it could be a new patient. And this is showing your patients that you are there to take care of them. A really powerful message to get across. They're going to remember this because a lot of people are not getting the care that they need or the attention they need. And a lot of people are nervous, scared, wondering how they're going to get taken care of right now. Also, if you're not taking care of your patients and they have an emergency, they're going to go somewhere else. They could go to the ER, or they could go online and find some dentist who is taking care of emergencies. And what's going to happen? You're going to lose that patient. Now, I know that there are some dentists out there who do not want to treat emergencies. You may be in a risk category yourself. You may be over 65 or even 70 plus and say, look, I'm not sure I want to see patients. This is a time to get an associate who is willing to see those patients. Bring an associate in. Maybe this is a time to begin your transition with an associate. But you can start with teledentistry and at least communicate with all your patients. Let them know that you're there to at least talk to them and that you're going to find somebody to take care of them. Use this. Even if you don't want to go in yourself, you're going to want to use teledentistry to take care of your patients, to be there for them in their critical time of need. And then ideally, you have some dentist, whether it's a friend or an associate of yours or an associate you've brought in, take care of your patients. Patient Pop's telehealth system is only $150 a month. That's a couple of patient visits at the most. This is going to pay for itself very quickly just in actual revenue. When you're not making revenue possibly in other ways, it's going to have you treating only the emergency patients that you have to see in the office physically. Also, if you're a Patient Pop client that uses their website and marketing platform, it's free for the first 6 months. But use something. Obviously, I recommend this. I think this is the perfect end-to-end solution for you. But by all means, use teledentistry. And I think you're going to find that this is going to become a permanent part of your practice. We don't know what's going to happen when people come back to visit dental practices, what they're going to want to be doing, how we're going to want to be seeing them. You may find yourself using teledentistry as a virtual front desk to see patients, to see who you need to bring in, who you can actually see, and bring stuff out to their car, bring their dentures out to their car or something like that. You're going to find this as a tool that you will use indefinitely in your practice. It will become an integral part of your practice. I'm sure of it. Now's the time to get good at it because now's when you need it most. So if you want for more information on it and a demo on how this works with the Patient Pop telehealth system, go to my website, fredjoyal.com/patientpop. You'll be able to put your name in and get a demo on it. I've also created a PDF of all of these 12 steps with the details on it so that you know how to do this and can apply this to your practice. I hope this has been helpful for you. I wish you great success and I hope that you come out thriving at the end of this crazy time. And I'm here for you, and I look forward to seeing you live face-to-face sometime soon.